Welcome back to the Arizona Daily Mix. October is National Breast Cancer Awareness Month. Joining us today is Dr. Lauren Maxham to tell us what not to do when it comes to your mammogram. And of course, the first thing is don't wait till October, because October is Breast Cancer Awareness Month. And I think all of us, you see the pink ribbons everywhere and you're reminded, oh, I should schedule my mammogram. But why is that a challenging time?
Sure. Like you said, October is Breast Cancer Awareness Month. Reminders are everywhere, pink ribbons, and everyone's scheduling during October. So oftentimes, if you're due for a mammogram, now is the best time to get it. Sometimes if you can't get an appointment in October, the appointment could be pushed over the holidays. And we know that a lot of times women are the ones planning, prepping meals, buying the presents for the holidays. So it's not necessarily a time where you can squeeze in an appointment for a mammogram. So we encourage women, if you're due for a mammogram, book it now, book it early. Get it off your plate.
That's a really great suggestion, because I think it's an easy thing to kick that can down the road and go, I'll do it in January. You know what? I'll do it in March. Oh, it's spring break. I'll do it. And early detection is obviously one of the most critical things in terms of approaching breast cancer. I think maybe the fear stops some people from booking and from, just pushing it back and pushing it back. Do you have any suggestions for women who are trepidatious about booking their mammogram?
Sure. So like you said, breast cancer is really treatable if it's caught early. Most breast cancers are seen in women over the age of 50. So a couple of things that we recommend. Number one, talk to your primary care doctor about your questions, your concerns. Maybe bring some questions with you to your mammogram appointment to talk to the technician who will be performing the test. Another great option is to get an accountability buddy. Ask a friend, someone who may also need a mammogram, schedule it at the same time and go together, and sometimes that can really help. At ArchWell Health, we also have a care coordinator who is there to help you schedule your appointment. So if you're not sure, which radiology facility accepts your insurance, or you may need some help booking, we have that available as well for our members if they need additional help.
So you're talking about a grown-up buddy system.
Yep, it's the best way.
Get a girlfriend, or maybe your sister, maybe your mom, maybe your aunt, and we're gonna book now.
Yep.
And while it's still summer, we're not gonna wait till October. And you said you even have somebody who can help you coordinate?
Yeah, so if you're an ArchWell Health member, we have someone who can help you figure out which place you go to get your mammogram. Every insurance is a little bit different, and they can actually book the appointment for you if you need that extra push.
Do you think some people's fears are around the actual procedure? Because, they smush you a little bit.
Sure. Yeah, so it's not the most fun thing. However, like we said, early detection is key with breast cancer. So definitely there's a little bit of hesitation around the procedure itself, around the test, but then also around the results. Sometimes the unknown can be very scary and very anxiety-provoking. So making sure you have a really good partnership with your primary care doctor. Maybe schedule an appointment just to go over your mammogram results if you have some anxiety surrounding it. But having that extra time with your doctor and knowing that you have that scheduled can really help with your anxiety.
That's a really great idea, because I know in my personal experience, a lot of times you do the mammogram and then they say, oh, would you mind waiting? We got to follow up with an ultrasound, and then your heart starts racing.
Yep.
But when you leave, you know that, hey, at least for the year, you're looking good, and that gives you peace of mind.
Definitely, and it's really important, to get a mammogram done every year, or at least every other year, so that you have that baseline test, and that increases the sensitivity of your mammogram so that the radiologist can detect early changes and see things that may be of concern. And again, like we said, when caught early, breast cancer is a very treatable cancer.
That's a great point. Get that baseline. Don't wait till October. Make your appointment now. Dr. Lauren Maxham from ArchWell, thank you so much for being here, and great reminders.